Welcome back to the show. Earlier this week, we celebrated National Women and Family Health Day, and this morning we want to talk all about how primary care plays such a big role in family health. Joining me now is Dr. Janice Johnston. Is it Johnston or Johnstone?
It's Johnston.
Johnston. Welcome to the show. Thank you from Redirect Health. So let's talk about the fact that leading a healthy life goes beyond just exercise and eating right. It really is all about having that trusted primary care provider. Why is that so essential?
You know, so many things we can identify through preventative screening, and so that's probably one of the primary things that your family doctor or primary care doctor will really help you with.
And so when you're looking for one, obviously you want to ask the important questions. What are those basic fundamental questions you should be asking? What should you be looking for
in a primary care doctor? So really what you want is to find somebody that's really accessible, and I think that's probably the biggest thing in primary care. With Redirect Health, we really want to make sure that we're super accessible, either by the phone. You know, we do a lot of things through telemedicine now, which is awesome. But you want to make sure that you can get in to see your primary care doctor as soon as possible, and make sure that they're doing all those preventative care screening items for you.
And talking about some of those screening items, I mean, they do prevent, obviously, a lot of things that we want to avoid, but our primary care provider also provides many services that many people may not realize they provide, right?
That's correct. So, you know, you think about maybe going in for a cough or a cold, those kinds of things. You know, for women, getting your pap smear checked is a huge thing. Getting your mammogram ordered, your breast exam as well. For men, prostate cancer screening. Skin cancer screening is something that a lot of people don't think about, and that's something that a lot of primary care doctors will do. And you know, just talking about prevention is a huge thing. We live in a state with the highest incidence of skin cancer in our whole country, and you know, we're blessed that we have such beautiful sunshine here every day, but we do need to make sure that we're careful about our skin.
So you brought some items with you.
I did.
Very important items that we need to incorporate into our daily lives.
Yeah. You know, I think exercise is probably one of the biggest things that you can do for your health. And even if you can do something for 30 minutes a day, is a great way. These little items, I mean, you know, there's lots of them now, Fitbit, to just track your steps and to see how active you are. Because when you're not active, you're at a desk job or you know, what have you, it's easy to kind of get out of that habit of not being so active. So these little devices can really help hold
you on track,
accountable.
Yes.
Yeah.
And how important is strength training to women at a certain age?
Yeah. Okay. So weights. I mean, Michelle Obama is my hero because of her arms. Like, who wouldn't want Michelle Obama arms?
Well, she got us talking about why they look so great.
They do. But exercise with weights is really important for women because of their bone health. And so, you know, as women age, osteoporosis becomes very common, especially as women get into menopause. And lifting weights on a regular basis will help to keep your bones really strong. Other things that you can think about to keep your bones strong are supplements. You know, simple things like vitamin D. We find, even though we live in this you know, community that we have an abundance of sunshine, so many people are vitamin D deficient.
Well, I'm one of those people, and I didn't even know that until I had my blood checked.
Yeah, and that's something that your primary care doctor can do to help to screen for you. You know, vitamin D, calcium, vitamin E, you know, a good B complex, those things are really important too.
And you mentioned the sunscreen too, and not just any sunscreen, right? Talk to me about the SPF and why that's so important.
Well, probably the most you really need to go is an SPF of 30. Anything over that, you're really not getting that much additional benefit from that. And you know, SPF is not just in, you know, the sunscreen that you buy, but it's in a lot of products that women use on a regular basis. So we use moisturizer and makeup every single day, and so get one that has some SPF in it so that you're getting that protection, you know, on a regular basis. We're good about doing our faces, but we don't go down so low.
True.
Right? And
we always forget our chest area too, which gets a lot of sun.
It does.
Very important advice. Thank you so much. If you'd like more information, you can go to redirecthealth.com. Thank you, Dr. Johnston.
Thank you.
Appreciate it. We'll be right back.